Appendicitis is a painful swelling of the appendix. The appendix is a small, finger-shaped pouch attached to the large intestine. It sits in the lower right abdomen. Appendicitis is a serious condition that requires prompt medical attention. The appendix's exact function is unknown. Some theories suggest it might play a role in immunity. However, we can live without it. Appendicitis occurs when the appendix becomes blocked. This blockage leads to inflammation and infection. If left untreated, the appendix can rupture. A ruptured appendix is a life-threatening emergency. It spreads infection throughout the abdomen. Appendicitis occurs due to a blockage in the appendix, which is a small tube-like structure attached to the large intestine. This blockage traps bacteria and mucus inside, creating a breeding ground for infection. The trapped substances cause the appendix to swell, leading to appendicitis, which can be extremely painful and dangerous if not treated promptly. Several factors can cause this blockage, each contributing to the risk of developing appendicitis. The most common cause is a small piece of hardened stool, also known as a fecalith, which can obstruct the appendix. Other causes include enlarged lymphoid tissue in the appendix wall, which can swell in response to infection. Intestinal worms, tumors, and foreign objects can also lead to blockages, each posing a unique threat to the appendix. Blockages prevent drainage and lead to bacterial overgrowth, which exacerbates the swelling and infection. This causes the appendix to become inflamed and filled with pus, a condition that requires immediate medical attention. The increasing pressure inside the appendix causes significant pain, often starting around the navel and then moving to the lower right abdomen. If left untreated, the appendix can burst, spilling its contents into the abdomen, leading to severe complications. This is a serious complication known as peritonitis, which can be life-threatening and requires urgent medical intervention. Appendicitis progresses through stages, each with increasing severity. It starts with a mild inflammation and can quickly escalate if not treated promptly. Early diagnosis and treatment are crucial to prevent complications. Medical professionals use various diagnostic tools like ultrasounds and CT scans to identify the condition early. The initial stage is simple appendicitis. The appendix is inflamed but intact. Symptoms may include abdominal pain, nausea, and a low-grade fever. As the condition progresses, it may develop into gangrenous appendicitis. In this stage, the appendix starts to die due to lack of blood flow. This can lead to severe pain and a higher risk of rupture. The final and most dangerous stage is perforated appendicitis. This happens when the appendix ruptures, releasing its contents into the abdomen. This can cause a serious infection called peritonitis. Appendicitis can also be classified into different types based on its location and complications. Each type presents unique challenges for diagnosis and treatment. Some common types include retrocecal appendicitis, where the appendix is located behind the cecum, making it difficult to diagnose. This type often presents with less obvious symptoms. Another type is stump appendicitis, where inflammation occurs in the remaining portion of the appendix after a previous appendectomy. This is a rare but serious condition. Understanding the stages and types of appendicitis helps doctors determine the best course of treatment. This knowledge is essential for effective management and recovery. Section 4. Recognizing the symptoms. Recognizing the signs and symptoms of appendicitis is crucial for early diagnosis and treatment. The most common symptom is pain in the lower right abdomen. This pain typically starts near the belly button and moves to the lower right side. Other symptoms include loss of appetite, nausea and vomiting, fever and chills, constipation or diarrhea, and swelling in the abdomen. It is important to note that not everyone experiences all of these symptoms. The location and severity of pain can vary. If you experience sudden, severe abdominal pain, seek immediate medical attention. Delaying treatment can lead to serious complications. In Section 5, Treatment Options from Surgery to Homeopathy. The primary treatment for appendicitis is surgical removal of the appendix, known as an appendectomy. This procedure is often necessary to prevent the appendix from rupturing, which can lead to serious complications. Appendectomy is a common and generally safe procedure. Surgeons typically explain the process to patients beforehand, ensuring they understand the steps involved and the expected recovery time. It can be performed laparoscopically, which involves small incisions and a camera, or through a traditional open incision, depending on the case's complexity and the surgeon's recommendation. In some cases, antibiotics alone may be sufficient to treat early-stage appendicitis. This approach is less invasive and can be effective if the condition is caught early. This is known as conservative management. Patients opting for this treatment are closely monitored to ensure the infection is resolving without surgical intervention. However, surgery is often the preferred option to prevent the risk of rupture. A ruptured appendix can lead to peritonitis, a severe and potentially life-threatening infection of the abdominal cavity. In addition to conventional medical treatments, some people explore complementary therapies like homeopathy. These alternative treatments are often used to support overall health and well-being. Homeopathic remedies aim to stimulate the body's natural healing processes. Practitioners believe that these remedies can help balance the body's energy and promote recovery. Some commonly used remedies for appendicitis include belladonna, for sudden intense pain and fever. This remedy is often chosen for its ability to address acute symptoms. Bryonia, for pain that worsens with movement. It is typically used when the patient experiences significant discomfort with any motion. And arsenicum album, for burning pain, anxiety, and restlessness. This remedy is often selected for its calming effects on both physical and emotional symptoms. It's important to remember that homeopathic treatment should not replace conventional medical care. Always consult with a healthcare professional to determine the best course of action for your specific condition. Section 6. Seeking medical advice. Appendicitis is a serious condition that requires prompt medical attention. If you suspect you or someone you know may have appendicitis, it's vital to seek immediate medical care. Do not attempt to self-diagnose or self-treat. Delaying treatment can have serious consequences. Your doctor can diagnose appendicitis through a physical exam, imaging tests, and blood work. Early diagnosis and treatment are essential to prevent complications such as rupture and peritonitis. Remember, your health is paramount. When it comes to appendicitis, it's always best to err on the side of caution and seek professional medical advice.